I used to work in senior care as a as a waitress when I was in high school. And after college, I had a degree in management, but didn't know what I wanted to do. And one of my friends said, "You love the elderly. Why don't you turn that into a job?" So I went back and started working in an assisted living, then worked for Marquis Home Health, and then have been here ever since.
You just love this type of work?
I love it. I absolutely love it.
Why?
Even on really hard days, I can see the difference that I make in people's lives in a tangible way. And if I show up and do what I'm supposed to do, it can be a really positive difference. And not everybody gets to see exactly what their work is doing in someone else's life the same way I get to see it daily. And I get to form really great connections with people at a really hard time in their life and hopefully help make it a little bit easier. And I love that. And working with the elderly keeps me very humble. They always have a side comment or two to say. They always have suggestions for me that I did not ask for on what I should be doing, what I should be eating, who I should be dating, what I should be wearing. It goes on and on. So they help me very much with living my life, I guess.
Be grounded.
Yes, they keep me very grounded.
You mentioned earlier as well that some folks are kind of surprised at times by, maybe some of your peers are surprised by how much you enjoy this work.
Yes. I heard a quote once that said something like, when you're doing what you're supposed to be doing, people around you will notice and it will wake them up a little bit. And that's how I feel in this job. I'm doing what I'm supposed to be doing, and the people around me, it's like rippling out to them. And I can tell that's what I'm supposed to be doing. Early on, when I started working with seniors, I had a hard time not taking stuff home with me because this is a 24/7 job. And once I learned how to deal with not really having a boundary and it just became a part of who I am, it's gone really well. And it can be really hard, but it brings me so much joy too. And like I said, I can see the difference that I get to make. And I realize not everybody likes to work with the elderly. I work a lot with end of life care. So stepping in, in those last couple months, weeks, days, hours. The first time I held someone's hand while they passed away, I realized I have the capacity to do this. I should probably do this.
Oh, sounds so hard.
It is. It's not easy when we lose somebody, but when they are feeling safe and they're comfortable and the family knows what's going on, you can't really ask for more than that when you're coming to the end of your arc of life. I've been pretty open about what I've gone through because I think it's helpful. I have to remember that not everyone has worked in healthcare during the pandemic, so my experience is different than other people's for sure. Part of my job is to make sure that each individual resident's needs are being met and their rights are being respected. And when we first had the pandemic hit, and I remember having to tell someone, her husband came to drop something off for her and she wanted to kiss him goodbye, and I had to tell her no. And I had to go sit down for a second in my office after that because it's never been my job to keep people apart. It's been to build bridges to bring them together. So having to be the safety manager in that way, the gatekeeper, was really difficult. And fortunately, people understood that it was for safety, but it was still hard. We got hit very hard here with COVID in June of 2020, the worst month of my entire life. And I remember where I was when I found out, you remember where you are in those big moments.
Yeah.
Someone had barely spiked a temperature and we immediately tested everybody. And by then it had already spread. And that's when I realized all of our planning, all of our training, everything we'd done in advance, all of our precautions, despite all of that, it had gotten into the facility, and before it was even detectable, had spread. And that hit me like a gut punch because I see these people every day and I work with their families and they feel like they're my loved one and my family member. And because I have those relationships, it was my job to call the families and tell them that their loved one had COVID. And that was a difficult call to make, but again, it made me feel better knowing that it was someone that they knew and trusted who was making that call. And, I feel really honored that people trusted us with their loved ones, and I was able to help them make those tough decisions. Do we want to go out to the hospital and be on a ventilator? Do you want to stay here and just be kept comfortable? And everyone who passed away here had made that very clear with their family and with the facility about what they wanted. So we respected everybody's individual wishes, but it was really hard.
Yeah.
I had COVID, and because so many people were positive, I was able to keep working. I mean, it was just all hands on deck.
Yeah.
And even when I was at home, eventually our house physician sent me home because I was...
Just to make clear, at that time, they were having some positive residents, or staff work with positive residents, not
Correct. So the majority of our residents were positive, and the few that were negative were moved to another end of the facility and partitioned off.
Yeah.
They did not ask me to keep working after I tested positive. I just kept coming in.
Yeah.
And we had a separate entrance we could go into and work with the already positive patients.
Yeah.
And at the beginning, I wasn't feeling the effects really, so I kept coming in. And eventually, when I started really feeling the effects, the physician said, "You have to go."
Yeah.
But I was so anxious at home. I brought my laptop home, and my roommate had to take it away from me because I was refreshing everybody's notes too often. She was like, "You can check it once an hour." So I came back pretty quickly. It was hard to be here, but it was harder to not be here.
Yeah.
When you have something like this as your job, you don't get to pull your heart out of it.
Yeah.
So my heart was here the whole time. These were my loved ones and their families that were suffering. And so it was hard to be involved in that, but I felt like all of the staff that were here, we had staff volunteer to come and work, which was really amazing and helpful because then their hearts weren't tied into it as much. They could just go about their business, and our staff who were sick or who were just their hearts were hurting, they were able to take a little bit of a step back.
Yeah. You mentioned how you first got into this work by noticing that you had this capacity in yourself to kind of handle those really tough moments
Mm-hmm.
for a little bit outside of what most of us can normally handle from our job. Did you feel like that experience specifically kind of showed you new depths even within yourself that you didn't realize were there?
That's absolutely right. I still liked coming into my job even during the pandemic, even during June 2020. I don't think I would have liked it if that's when I had started working here, but I was already so entrenched in all of this that it made it possible to keep coming in. Being able to make those phone calls and be the liaison with families took it off the shoulders of another staff member who then was able to go out and work on the floor. So we all just came together and did our piece, and everybody worked to their capacity. And I knew that I was able to have those tough conversations and bear the anger or frustration or fear from family members and from residents who I had to tell, you tested positive. I knew I was able to carry that because I'd carried it in small ways before. So I knew I could shoulder that, and that would be my part of what I would do for us. There was one time where it really broke me, and I walked out of the facility into where they're developing back here. It was just a field, and I walked in there and I just fell down and cried. I cried for maybe 10 minutes. And then I walked around for 5, and then I came back in and called more families. So, you find ways to, sometimes it gets to you and you have to step away, but you come back in and you keep going with the patients you still have.
Is that a specific thing that happened, or just it piled up?
I had a family member who I had been talking to every day to give updates on her sister. And we had all of the decisions in place, but she just kept hoping a miracle would happen, and we kept hoping. And when that patient died, I called the sister, and she had talked to me the day before and had just begged me, please, please. And it was so tough to have that conversation. I would do anything I could, but there was nothing we could do. And to know she had just begged me the day before, and to have to call her the next morning and say, it happened, she went this morning. There was just this silence that hung on the phone where I didn't want to hang up. She didn't want to hang up, but neither of us had any words. Yeah. And eventually she just said, I'll call you later, and hung up. And that was really when the weight of it hit me, that we were so helpless, and that despite our team doing everything they could, the patient had made their wishes clear. They didn't want any drastic heroic measures, and we respected that. But beyond that, there wasn't anything that we could do. And just feeling that helpless to help people, which is my job, that was what really got me in that moment.
So hard. I just want to tell you how much I admire you and your team being in that type of situation that's so difficult and so important, caring for this generation of vulnerable people who have so much wisdom and so much still to offer our community, and who have done so much for our community. Yeah. I couldn't do it. I just respect and admire the hell out of you guys for that.
Well, I appreciate you saying that. I think it's a good thing to keep in mind. This pandemic has gone on a lot longer than any of us expected. And I think everyone's kind of at their breaking point in one way or the other. But keeping in mind when you're dealing with healthcare workers who are enforcing a policy or giving you information, that these are some of the burdens that they're carrying is from situations like this. Yeah. I think that's just a good frame of reference to have in mind.
Yeah, absolutely. I wanted to hear and ask you about how things have been sort of post-vaccine. I understand you've been able to do a little more. Residents have been able to open things up a little more, and morale has kind of improved because of that. Obviously, still being very safe and regulated and whatnot, but things are different.
Yes, thank goodness. Marquis was great about getting us the vaccine as soon as they were able to. So I got my first dose at the mid-December, end of December.
You were one of the first in the state.
We were some of the first in the state, and being able to call the families and tell them we have the vaccine, and tell the residents, it was tears of joy. And I will never forget, after there's a husband who lives in the facility and a wife who lives out in the community, and after he and she had both received the vaccine, the first time that she came in and was able to come in and visit with him without the barrier between them, and I told her that she could hug him, and they both just started crying. And I'm going to cry again, but I started crying, and they just stood there holding each other for maybe 5 minutes. Just not saying a word, but just not being able to have that physical contact for so long, and then being able to touch each other again and really feel tangibly, you're okay, you're here, you're still warm, that was amazing. And we've been able to make the vaccine available for residents and staff, but also for family members of staff and family of residents and community members. So it's been great to be able to have people call and say, the wait times or this or that, and say, come on down, we've got our clinics on Wednesdays, we'll get you a dose. Yeah. And being able to have people be back in the dining room eating together again, and be able to do some events and just see things start to go, not back to normal, but more in that direction. It's bringing so much life back to us and bringing so much life back to the residents. They have things they're looking forward to again. We haven't really had an end in sight, and there's still not a set date on the end of the pandemic, but they're knowing that we're heading in the right direction, and they're able to see more and more of what they love to do during the day starting to be able to happen again. And it may look a little different. For example, we're doing bingo in shifts, so we don't fill the room and crowd it, but they're still getting to go back to playing bingo with each other. And we have some very competitive bingo players. Yeah. So being able to be back there and talk some trash to each other and win some prizes and do that again. It doesn't look the same as it did before, but we're starting to get to do that again. And for people who their lives look very different here than they did at home, starting to have those things back to normal a little bit, it's just huge. It's huge. I had COVID in June of 2020, and I'm a healthy 30-year-old, and I was just at the cardiologist again yesterday for a follow-up appointment. So just a reminder to everybody, please be safe, whatever that looks like to you. I think it's easy for people to write this off as something that only affects the elderly, and it did here, but some of us who had it are still having long-term effects from it that's limiting our daily life a year and a half later. So just being an example of what that looks like and being open about that, I think has been helpful. It's not to lecture anybody, but it's because I don't want anybody else to go through what I've been going through, or what unfortunately some of my coworkers have been going through back from when we had COVID in 2020. So just a reminder to people, be safe, because it's affecting everybody. The second thing would be that people come to us on their worst day, on a really bad day. We get, no one wants to be in a skilled nursing facility. No one wants to leave their home. I mean, we're not getting people at the best time of their life. We're getting them in the sunset years, as they say. But it's a very confusing process. Healthcare, senior care, insurances, the different types of facility, all of that. I would say that myself and others of our team members, our job is to be here to be a resource. Even if you don't have someone at Marquis, we're here to help navigate that. And I think people wait too long to ask for assistance, or don't ask someone who's already walked through it previously. And we are here to be able to help guide you through that.